you woke up from a tooth extraction,
Right.
and what happened?
I woke up from a tooth extraction and I felt very disoriented, just didn't feel right. I stood up and my balance was very off. And I knew that something was really wrong. And I tried to seek help from my oral surgeon. And he actually said to me that, it wasn't my doing, I don't know, it could be something else. And he gave me absolutely no help whatsoever. And that in itself is a very big problem because he didn't want to help me at all and try to solve what exactly the problem was. And I knew—
Where was the jaw?
My jaw was popping in and out, and before that I never had any trouble in terms of like having TMJ with my jaw locking. And I started noticing that my jaw would lock when I opened and closed my mouth, and that was a really, really big problem. And I started experiencing a lot of facial pain, tightness in my eyes, in my hands, tingling all the way from the tip of my fingers all the way up and down my arms and my legs. And it became really, really unbearable for me, to the point where I would take Motrins every couple of hours because I felt like the ibuprofen would really help the pain for me. I never really had a lot of hard headaches, but I felt a lot of pressure in the back of my neck into like the base of my skull, and a lot of pressure around my eyes. And mostly it was balance problems. And I think one of the biggest scares for me was walking around the street in New York. I'd feel completely disoriented in the sense of having like I felt like my head was kind of off of my body, like it wasn't centered. And I knew that because of that, there was definitely a very big issue happening. And I went to so many different doctors and they told me, no, like there's nothing wrong. I took an MRI and they said you have nerve damage in your neck and you could possibly have multiple sclerosis. And my dad actually had Parkinson's for 7 years and he passed away from that. And being a 22-year-old and 21 at the time, that really, really frightened me. I was horribly terrified by the whole experience. And I thought, oh my God, like I'm 21 years old, how could I be developing such a disease? And I just kind of researched a lot, looked around and was researching different options and found Dr. Kerr actually on a website on YouTube. I saw the doctors and I said, wow, this lady Heidi has a lot of similar symptoms to what I have. Maybe this is something that I should get checked out. And, I think it was definitely like I really, really needed to get help and I really needed to talk to somebody about this. And I came to Dr. Kerr and he offered me a lot of really great advice and he, kind of looked me over and told me that everything that I had been experiencing was normal and it wasn't crazy, that this could be the answer. So I'm just very, very lucky and blessed. I had a lot of pressure like around my eyes, mostly like in my sinuses. And I think for me, the most horrifying thing was I'd feel this disorientation a lot of the times, to the point where I would look in the mirror and I could hear my voice, but I couldn't coordinate my like physical self, so it was like a spatiality problem.
How long did you experience symptoms from when you got the tooth extraction and then all the symptoms started? But I understand it wasn't related to the tooth extraction.
Right, yeah.
The idea, here's what I think happened with this whole tooth extraction business. Tooth extraction is a messy business just to begin with. The amount of force that they have to put on the jaws and certainly up into the skull, when you have your teeth extracted, it can get really, really, the forces can become significant. So what I think happened with Allie is when they were pulling, they pulled so hard that it disrupted how the head was sitting on her neck so severely that it disconnected her again with the brain tissue and the body tissue. And I think you were probably feeling okay up until the tooth extraction.
Right, I was.
So when you have someone who is completely normal, the nerves are functioning right, and all of a sudden you create an insult, then it turns into a big acute situation, and which can get very frightening.
Right.
Especially For someone who was feeling normal to start to begin to, I'm looking in the mirror and I hear myself speak, and then you go to the doctor and say, well, I'm having this thing, and the doctor looks at you.
You think you're crazy, and they think you're like completely out of your mind.
Right. So, and then the walking issue, and how long did that, from the time you had your teeth extracted up until you got to me, how long was that period of time?
That was about, I came to you, I think it was about April, it was the springtime. So it was a good 6 months, I think. And prior to having all of this, you know, I was extremely athletic. I've done 2 half marathons in San Francisco. So I've, you know, really been athletic. I was a swimmer for a really long time, and I play a lot of sports. And I never, you know, I was extremely healthy, and I never had any problems. And then this happened to me, and it changed my life forever. So
what was going to change your life?
Right.
Now we're getting back to normal. But here's someone who was very athletic, very healthy, and is now worried about walking down the street and not getting better, and going to doctors who don't really understand. And you can kind of understand that they don't understand, because frankly, I mean, I'm used to dealing with patients that have your symptoms.
Right.
But if you have someone come into you and say, well, I have this, this, and this, and like, well, it's not in my vocabulary medically, so it must not exist. So I don't know what box to put you in. I don't know how to help you. So let's start looking at maybe it's psychological. And there are tons of people, sick people out there that have been told it's in your head. Now, can you imagine if you accepted that and said,
you'd go crazy.
It's in my head.
Yeah.
There's nothing going on. And I'm sure their patients, the doctor keeps telling them, it's in your head, it's in your head, it's in your head. And they finally say, you know what, it's in my head, I'm going to shoot myself because I can't live like this anymore.
Definitely.
Right? So the period, that 6-month period of September, or whatever, how long it is, September to April, the symptoms weren't getting worse. The symptoms weren't getting better. They were
getting worse. And another thing that I actually wanted to talk about was an experience that whenever I would take a shower, for me, I'd have a very hard time kind of putting my head back, and that was another way that I knew that it was definitely a neck or head related issue. Because the pressure of, you know, washing my hair, I'd feel a tension all in my neck, and it was so hard for me to just wash my hair and stand in a shower. I'd feel so dizzy, so disoriented, that it was terrifying, absolutely.
So this is what was happening with that. Her head wasn't sitting right on the atlas bone. So when Allie's in the shower and you go to move your head in the shower, it further accentuates that misalignment, making her feel more of the symptoms she's supposed to feel when you have pressure at the base of your skull. The symptoms that she's having make total sense to me. And I think all the Atlas upper cervical doctors out there will say, well, that makes sense. So here is a young, healthy girl, 6 months of not feeling well, and not just not feeling well, getting ready to deteriorate her life. She can't exercise anymore, and she was very athletic. But the big thing for me is when someone tells you this is what it is.
Right.
You know, for a 21-year-old girl, that can't be possible.